So I work as a clinical psychologist within NHS substance misuse services, and what I'm going to talk about is a project that I've been heavily involved in facilitating recovery into treatment, substance misuse services, into treatment services. And perhaps I should start by saying that traditionally there has been a large gap, a large divide between treatment services and recovery organisations. So on the one hand, with treatment services, we tend to work with people who have acute physical health needs. So we're working with the chaos and the social implications of addiction that people are coming into service with. And we work quite well on sort of helping people to gain some stability in their lives. And recovery is something that is usually somewhere over there. Recovery might be things like mutual aid, like Alcoholics Anonymous, or there's newer ways of doing things, and smart recovery kind of being one of them. And so what traditionally happens is we deal with the chaos, and then we might, if the person's quite lucky, inform them of where an AA meeting is being held. And of course, that's not a very effective way of getting people involved in mutual aid, just signposting them to kind of recovery organisations. And just to say that our treatment services are typically dominated by a kind of a medical model of addiction. And so that means we're dominated by often pharmacological solutions for the problems that people face. And this has two effects, really. One effect can be that if somebody comes in with an alcohol-related problem, that they can be detoxed fairly quickly. 2 weeks' time, you can have an alcohol detox and you can be through that. A period of stability, and then what we do is we signpost that person off to somewhere else, and we discharge them fairly rapidly. And as you've heard from Winfred and you've heard from Wolf, people tend to go on a revolving door and they come straight back into treatment after a short period of abstinence. So we're either discharging people really quickly, or we end up doing another. If somebody's got a heroin addiction, perhaps they'll go on to a substitute medication script, maybe a methadone script, and we'll keep those people in treatment for quite some time, perhaps up to 20 years. They can be on a methadone script. And so this effect is we're either discharging people, it puts pressure on our service because we have a large number of people coming in and a trickle of people going out. So our services are really struggling to cope. That has an effect that when we do get people stable, perhaps with alcohol consumption, they get discharged even quicker. And of course, then they come back around, and the implications of that can be quite severe. We do psychosocial intervention in treatment, but where they exist, typically, these are developed by experts based on theoretical models. Some of them might not be anything to do with substance misuse. They can be delivered by specialists, people who have perhaps a filtered down level of expertise. So these might be social workers, nurses and the like, who have learned how to do a technique, and they will try to deliver that in treatment. Often they're technically quite challenging, these psychological interventions, and they're time limited, they end. And they come to an end, and then we discharge people, and we discharge them to signpost them onto something else, and maybe not too much else. But if you look outside of treatment, you'll see something really quite promising, and a growing area where there are service users and ex-service users who are in recovery. And these people have practical lived experiences of what works to aid recovery. They've kind of walked in those steps. They have a range of skills and knowledge that they want to pass on to people. And they say it as it is. They don't use any jargon often. Sometimes maybe quite bluntly, but they talk in quite practical ways about what works for somebody in recovery, what their experience has shown them. And of course, recovery doesn't happen 9 to 5 as it goes. And these are people who will do things with people outside of the 9 to 5 timetable. And they'll offer a range of activities that people might get engaged in. So what we have really is treatment on the one hand, and we have recovery on the other, and there's a gap between them. And there's all sorts of really promising things that are going on in recovery. There's a whole list of things. I could have put more things on there. I could have put the living room on there. Sorry, Winford. But I could have put all kinds of different things on this. Phoenix, Link. There's all sorts of different areas that's really growing now with recovery organisations. People in recovery really supporting other people in recovery. So what I did with a colleague in helping groups to grow, an organisation, a charity down in Carmarthen, is to set out a way of facilitating recovery into treatment services. So we set out to develop a group programme for treatment services that would be developed with service users using their lived experiences of what worked for them in their recovery. It would be evidence-based, would be underpinned by psychological theory, but it would also be quite easy to understand and deliver, and for these groups to be co-facilitated by people in recovery themselves. And we wanted these groups to be directly linked to these recovery organisations which are growing and which are out there. So we came up with a programme or an intervention, and I'm going to talk you through what that is. It's called the Moving On in My Recovery programme, and I'll tell you a bit about how we've gone about doing that. So we got some money from Welsh Government to develop materials for the project and to run a pilot project back in end of 2014 and beginning of 2015. And the programme does support the Welsh Government policy for the development of mutual aid and peer support as a key component of the provision of drug and alcohol treatment. So it says it, but often we don't kind of do it. Excuse me. So we developed the programme by asking more than 100 people in sustained recovery 2 questions. We asked them what practical techniques and skills had helped them in their recovery and what topics they found helpful to discuss earlier on in their recovery journey. And we had 7 focus groups, and we visited them on 2 occasions. And you can imagine we got quite a lot of information from people about what worked for them in their recovery. This is what we came up with, 12 sessions, some related to well-being, some related to specific issues that people experience. So the start of the programme really is about people's well-being, not too focused on addiction as such, but more on building a life worth living, I guess. And then talking through some of these concepts like coping with anxiety, managing mood. We touch on relapse and that process. Importantly, we talk about peer relationships, relationships with other people. And then we start to touch on some of those other things that Winford described, which was about kind of looking at who I am, what kind of that journey that the person's had through life and how they might have lost themselves in that journey through their addiction. And then dealing with loss. So not just loss of bereavement, but also loss of substance, loss of role, loss of job, a whole number, loss of health, a whole number of losses that come up. Helping people to deal with the stigma and tarnished reputation that they've experienced through their addiction. And then we go through on to the next steps. So the materials that we put together were actually based on kind of what people told us, their lived experiences, but they needed to fit with the evidence base. We had a graphic design company who helped us to reduce the words and to use a lot of metaphor and pictures and images. And the programme is underpinned by something called acceptance and commitment therapy. So it's kind of, at the back of this programme is a framework of acceptance and commitment therapy, but on the front end, probably the clients, service users who engage in the programme probably wouldn't even know it was acceptance and commitment therapy. So the sessions don't contain anything theoretically new. These are established techniques and things that people have kind of been around for quite some time. But the groups, really importantly, have a lot of discussion, talking with people who have those kind of shared experiences of addiction and who maybe have come through kind of the other side. There is an element of the program where we're helping teach people new skills and teaching new ideas. And there's a really strong behavioural component to the intervention in that every week we set a challenge. We ask people to kind of do something every week which might be aligned to one of the topics. And then at the start of each session, we will actually go through and say, well, what is it that you did this week? So there'll be a check-in, and there'll also be a look at what challenges people have done and how they've got on with those challenges. So the sessions are actually facilitated by people in recovery and who are part of an existing recovery group, alongside staff from treatment services. So we've got kind of a joint approach in terms of how we deliver the intervention. The sessions are targeted at those who are relatively stable in their recovery, and these might be people who are looking to exit formal treatment. The idea being that people who are in treatment, who are looking to leave treatment, might get them involved in these recovery organisations which are out there. So we'll have somebody from a recovery organisation which will be trained to deliver, co-facilitate the group, and they'll co-facilitate it with somebody who's treatment staff. So a progress to date, so we've had about 2 years now, or less than 2 years really, of work on this, and the programme's been commissioned by quite a number of people now right across Wales, 3 statutory services including BCUHB, who I work for, and we've trained more than 100 facilitators, and we've had more than 600 people go through the programme. And what's happened is the programme's really snowballed. So the groups are rolled out now in 25 locations across Wales, Aberystwyth, Bangor, you know, it goes on and on and on, the length and breadth of the country. And so what's happened with this programme is that people who have facilitated it have told other people who have been on the programme have gone on to facilitate, and people are kind of more and more getting engaged, and we have this kind of snowballing effect that's happening with the programme, and it seems to be growing and growing. Up in North Wales, we've been commissioned for 3 years to roll out Moving On in My Recovery. We've only trained 28 people in North Wales at the moment to facilitate groups. We've probably run groups with over 100 people, and we're in 7 locations at the moment: Bangor, Carnarvon, Holyhead, Llangefni and Pwllheli. It's the first region to be rolled out to, the 2 teams in Anglesey and Gwynedd. Conwy and Denbighshire were next, so we've only got 2 groups running here, but 1 in Rhyl, 1 in Llandudno. And the plan is in July to roll out the training to staff in service users in Wrexham and Flintshire. How effective are we? Well, we use a recovery strengths questionnaire pre and post intervention. It's non-validated, so we kind of, you know, it's not, we haven't got a heavy measurement effect here. We've got low attrition rates, I suppose, which says something about the intervention itself. So we've got lots of people when they engage, if they get to week 2, the chances are that 3/4 of them are going to get through the whole programme. That speaks kind of volumes about the programme, really. It's a really difficult to reach population. And anecdotal evidence is off the scale. And, you know, I'm a scientist practitioner, and I don't want to sort of just spout off these kind of anecdotal evidence, really, but it is quite surprising how well the intervention works at helping people engage in their lives. We've had people who've been on methadone scripts for 20 years, who've gone through this program and have decided that, you know, they're no longer going to be on a methadone script, and they've come off. And once one person does it, it has a knock-on effect to other people. We've had loads of people who are really engaging in things and getting engaged in their recovery, facilitating groups and so on. And I would say, from my perspective, that what we're doing really here is we're increasing psychological flexibility. So from an acceptance and commitment therapy, I think we're achieving our aims, and we can see this in how flexible people become around the kind of content of the thoughts that go through their mind and the way they view themselves in the world. And that, I think, is it. That's me done. Thank you.